Hi, my name is Helene Turner and I'm a student at Grand Canyon University. I'm studying for a master's degree in nursing leadership and I'm currently taking LDR 620, Leadership as a General Manager. Today I will be presenting my strategic plan to help improve the staff cohesiveness and increase our patient satisfaction scores in the perioperative areas. We are a hospital that is a mid-size. We do about 35 to 45 scheduled surgeries each day, and we handle emergencies on top of that. We are also a level 2 trauma center. We have 3 shifts that all flex in at different times. The day shift starts at 7. We have nurses that come in hourly from 7, 8, 9, 10, and 11 o'clock. And then our evening shift starts at 10:30. They're 10:30 to 11, 12-hour shift. We have shorter cases that come out in the morning, and we have the heavier cases that come out in the afternoon. So we want to have the maximum staff in the 11 to 7 area. We also have a 7P to 7:30A night shift, which handles a lot of the emergency surgeries, and they also take care of any patients that have to stay overnight in the recovery room due to lack of beds. Our 3 shifts are very separate in personnel and getting along with one another. And my plan is to help make the 3 shifts understand the problems of each shift so that we can work better together as a unit. The stakeholders to the post anesthesia care unit are the nurses, and these are the OR nurses, the recovery room nurses, the ASU nurses, and also the floor nurses that take our post-op patients. The doctors, who are the anesthesiologists and the surgeons, our patients, our ancillary staff, which are the transporters, our aides, and our unit clerks, and the family members who are concerned about their loved ones having surgery. Our hospital mission is part of the Catholic Health Services mission, and our hospital does not have its own vision. I would like for our unit to have a vision of its own so that we can work towards the vision of our unit. My first part of the plan is to bring together a committee of staff members, nurses, ancillary, and some physicians to come up with the vision for our unit. I would like this to happen within the 6 months of the development of the committee. The group would introduce the vision to the staff meeting, and the members of the committee would have to be part of the committee as part of a volunteer basis. This would help to give direction to our staff and to help make the staff realize the direction that we want to go in as a unit. The group will also, over the period of the next 6 months, come up with activities to help bring the staff together and make them more cohesive. One of the first activities that I would like to introduce is the introduction of the fish philosophy to our staff. The fish philosophy was developed at the Pike Fish Market in Seattle, Washington. At the fish market, they came up with a philosophy to incorporate having fun and included their customers in the process. The fish market is a tourist attraction in Seattle now, and people go to see the workers throwing fish to one another, and they include their customers in the in their job, so it makes it fun for everybody. The principles of the fish philosophy are to be there for one another, to choose your attitude, to make the day of your patients and your coworkers, and to have play while you're at work. These principles can help improve our communication between the nurses and the physicians. I think that sometimes we need to remember that everybody has a life outside of work, and you need to be there to support each other, to help make their day and to have some fun while you're at work. And you can also include your patients in having fun And you have to come to work every day with a good attitude. And I think that making these philosophies part of our everyday will improve how our patients react to us as a group. The group will present the fish philosophy for approximately 6 months post the original 6 months of coming up with their vision. And we will survey the staff before and after the presentation of the fish philosophy. This way we can see if bringing in these concepts to the recovery area will be improving the attitude and helping in the nurse satisfaction of working in the recovery room. As the committee goes on, we will add and subtract members as they want to leave and come on to the group. After a year, we will evaluate to see if this plan was effective. We will also monitor during this period the HCAP scores and the Press-Ganey scores to see if our patient satisfaction scores improve. And we will also check the nurse satisfaction scores to make sure that there is increased satisfaction amongst the nurses. I really hope that you have found my presentation to be informative, and that if you have any questions, I'm ready to answer anything that you may want to know. Thank you.